Hello, I'm Dr. E. Barry Gordon, and this is the 12th video in my series on testosterone deficiency, the hidden disease. In the last video, we discussed two diseases of testosterone deficiency that can arise in adolescence, both of them in situations where those affected never reach the point of producing adequate amounts of testosterone. One of these was the well-known and well-recognized disease of adolescent hypogonadism, a condition where essentially no testosterone is produced. The other was a condition I believe not only exists, but is also very common. In this disease, what I call post-adolescent testosterone deficiency, testosterone is produced, but not quite enough to allow these men and women to develop an active libido or reach full mental maturity. Today we begin the much broader topic of what happens to people when once adequate levels of testosterone begin to decline. That group includes, or will include, just about all of us. For most men and women, the most common initial sign of testosterone deficiency is a triad of symptoms: chronic fatigue and lethargy, depression and/or chronic anxiety, and some loss of interest in sex. I've noticed over the years that while people of both sexes readily admit to or even complain about being newly fatigued, depressed, or anxious, they seldom want to recognize that their libido is on the wane. A question of, "How's your sex drive?" is usually met with a reassuring, "Fine," or "There's nothing wrong with that." But then my follow-up question, like "When you were in your early 20s?" most often brings out a "well," as if, of course not, I'm getting older. Facial expressions reveal the displeasure involved with an admission that physical affection is not on the mind as much as it used to be. As I've discussed previously, female orgasm seems to be a very sensitive indicator of testosterone health in that gender, and women may enter this early phase of testosterone deficiency by first experiencing a new difficulty in that area before they begin to lose interest. Their inability to get sexual satisfaction becomes very irritating, but eventually their libido drops so low that they stop thinking about sex, so they no longer care about orgasms. It is very common for women to deceive themselves, to think that they've made a conscious, intellectual decision to forget about sex, when the reality is their shrunken, withered, insensitive clitoris. It doesn't have to be that way. Both sexes also commonly gain weight in the form of abdominal fat, a documented consequence of testosterone deficiency. I've recently become aware of something else. While testosterone deficiency promotes the accumulation of abdominal fat, it is also responsible for the loss of shape, the flattening of female buttocks. After a couple of years on testosterone replacement, it's common for women to see that their belly is getting flatter, their waist is getting thinner, and that their behind is getting round again. It's another example of nature's common sense. There's little point in restoring a woman's libido without also giving her the means to attract a mate. Some or all of these symptoms most commonly begin in women between the ages of 35 and 45, and in men maybe 5 to 10 years later. There are many of both sexes, however, who have symptoms at younger ages, much younger ages. The time of life that testosterone loss begins, the rate at which the levels fall, and the effect the decline has on us all vary quite a bit and are probably under genetic control like many other age-related conditions. Many people with these early initial symptoms, especially the younger ones, seek medical help. They're rarely successful. They wind up being diagnosed as being too tense, or suffering from depression, or chronic anxiety, or as having the chronic fatigue syndrome. They're often prescribed tranquilizers or antidepressants. I have nothing against these types of medications, but they seem to be the least effective when testosterone deficiency is the most prominent cause of their problem. Those who are older when they begin to recognize these changes often attribute their loss of vitality to their stage in life. They've simply reached middle age. They've getting on in years. giving no thought at all as to exactly what it is that is responsible for their deterioration. Of course, there's much more to human emotions than just hormone levels. We're complex beings, and character and personality play a prominent role in our perception of and our reaction to the effects of testosterone deficiency. Some personalities reflexively refuse to recognize that there's anything wrong with the way they feel. At the extreme, these people will drive themselves to act and behave as if they were younger, vehemently denying that they've changed in any way, no matter what other people may see. Other personalities will focus in on any symptom and amplify it. It's not something people do on purpose, it's just the way their brains are wired. I believe that many, if not most, cases of the so-called chronic fatigue syndrome are nothing more than a focusing in on the tiredness and lethargy brought on by testosterone deficiency. And that can begin at any age. Here's a couple of case histories. Susan was in her early 40s when she first complained of excessive fatigue. She'd been a patient for many years, and this was the first time she had mentioned this problem. Her sex life was fine, so I didn't consider testosterone deficiency a likely possibility. This was quite a few years ago, before I knew better. A routine workup revealed nothing wrong. Fatigue, however, continued to be Susan's primary complaint at every visit for the next 2 years. I recall her saying, "I can't get up in the morning. When I get home from work, I'm so tired I fall into bed." After repeatedly finding nothing wrong with her, I finally checked her testosterone level. I was surprised to find that it was very low, and we agreed she should try some testosterone replacement. The first shot did nothing, but I wrote down her words when she came in for her third. "Dr. Gordon, 2 days after that second shot, when I opened my eyes in the morning, I knew something had changed. I jumped out of bed, full of energy. I was a different woman." Lisa was 28, the mother of 4, when she first came to see me. One of her major complaints was extreme fatigue. From having friends, just a few years earlier, marvel over how much she was able to do, she now feared for her children's safety because she kept falling asleep during the day. Upon questioning, she admitted that she used to like sex, but now found even the thought of it distasteful. Lisa's testosterone level came back very low by my standards, and testosterone replacement completely eliminated all her symptoms. These are just 2 examples that stand out in my mind because of the severity of the fatigue and the rapid dramatic change. But I would say that my success rate at eliminating or greatly improving these early symptoms of testosterone deficiency in both sexes is over 90%. This symptom triad, this decline in sexual interest and activity, along with fatigue and depression or anxiety, is the beginning of our very slow, very gradual descent into the infirmity and debility of old age and then death. Along that decades-long road, testosterone deficiency will ignite or fan the flames of a host of diseases that lead to our end. Diseases that could have been prevented or greatly lessened had our testosterone levels been restored. If you recognize yourself as having this symptom triad, get your testosterone level checked. But before you do, it is critical that you watch video 6 carefully and study the testosterone testing section on my website, www.thehiddendisease.com. Testosterone testing is at the bottom of the medical studies page. Make certain you get the right test done and that the results are interpreted properly. Very few doctors want to know about the disease of testosterone deficiency, so they are uninformed about the major laboratory problems with its diagnosis. The subject of my next 2 videos will be osteoporosis, and after that, prostate cancer. Again, if you find this information important, please tell your friends and relatives. Email these video links to everyone and ask them to do the same. I'm Dr. E. Barry Gordon. Thank you for watching.